Hello and welcome to the Alginate Impression and Pour Clinic Competency Calibration. This video is just meant to help faculty members help students do their impression and pour for their clinic requirements. I'm just going to run through each line item on the competency form and kind of explain what we're looking for, how students can make mistakes, and how we can help them correct the mistakes so they can improve their scores. So to begin, we have the impression technique. The first line item is that the impression material is properly mixed. So this should be homogeneous, which means all one consistency, and we're looking for a creamy mixture. We want to use the spatula against the side of the rubber bowl to limit the air incorporation so that we don't get voids in the impression. To properly load the tray, you want to take the spatula from the posterior portion of the tray and working your way anterior. You want to make sure that you're pressing the spatula into the material within the tray to press any air out to, again, eliminate voids. And then it's really helpful to smooth the alginate on the tray with a wet finger just so that it's a more even surface when you're inserting it into the patient's mouth. For proper insertion for a maxillary impression, a right-handed clinician should be standing at the 11 o'clock position and a left-handed clinician should be standing at the 1 o'clock position. For mandibular impressions, a right-handed clinician should be standing at the 7 o'clock position and a left-handed clinician should be standing at the 5 o'clock position. To stabilize the tray for the setting time, they should be using their index finger or thumb like how it looks like in the picture, and make sure that the patient puts their tongue to the roof of their mouth if it's a mandibular impression so that the tongue is out of the way and not interacting with impression in any way. To properly remove a tray, you want to put your finger in the back top side of the tray. So you're going to kind of hook your index finger all the way around the back side of their arch. So for maxillary arch, kind of in that maxillary tuberosity area. For the mandibular arch, you're going to be kind of in that retromolar pad area. You're going to hook your finger underneath and kind of do a quick snap. If you do it too slowly, the alginate material will pull away from the tray. So after the student removes the impression from the mouth, what we're going to be looking for is that the tray is not visible in the impression. So if the tray is visible in the impression, that's a -1 on the competency. Reasons that this can happen is because they put too much pressure on the tray when they were stabilizing it, or the patient bit down too far into the tray. Sometimes if you have the tray off center, so that would be considered incorrect alignment, that can kind of make the impression go through the impression material into the tray. And then also if the tray is not the correct size for the patient, that also causes the tray to be visible through the impression. Bubbles are air voids in the impression, which is going to be the most common issue that we have in impressions of our students, most likely, is that they were mixing the alginate like eggs rather than using the spatula against the side of the bowl to reduce the air that's incorporated into it. Also, they could be loading their tray incorrectly when they're putting the alginate material from the bowl into the tray. So again, that posterior to the anterior is very helpful in eliminating any air bubbles that are trapped in the alginate material before it's even put into the patient's mouth. Another thing that I see sometimes with bubble or air voids is that it's on the occlusal surface. So a little tip that I have is to take whatever excess alginate materials in the bowl on your finger and rub it on the occlusal surfaces before you place the tray into the patient's mouth. Again, for the impression not being centered in the trays, that usually happens because they're using improper chair positions. What I see most often is that clinicians will try to take a maxillary impression in front of the patient when they should be standing behind and off to the side of the patient. For the maxillary tuberosity not being recorded, that likely is because the tray is not big enough. So a lot of the times the students tend to gravitate towards a smaller tray because it's a little bit more comfortable. But if the tray is not big enough or long enough, then they're not going to be getting all the anatomy that they need. Another thing is that students sometimes forget that you need 3 scoops of alginate material to take a maxillary impression. So if there's not enough material to go around, then the maxillary tuberosity is a place that is missed. And then lastly, if a student is using the most appropriate tray size for their patient, but they still are having difficulty getting that maxillary tuberosity, sometimes adding the utility wax to the periphery of the tray is very helpful to get that added length that we need. Other impression qualities that we're looking for is that the vestibule and frenum are recorded. So a big thing is, this is kind of hard to get for students sometimes, you need to be able to get your finger up and around the lip and pull their lip over the tray and then hold their lip over the tray down with your thumb. very much like what's in the picture on the slide. So that is a big thing, making sure students are having their patients positioned like in that picture to make sure that we're getting the alginate to stay in the vestibule so we can get the vestibule nephritum. Again, adding wax helps with getting that height that we need, and then sometimes, again, you can just rub a little bit of alginate in the places that you're missing to kind of help get those areas better. If the palate is inadequately recorded, sometimes it's from voids, sometimes it's because they have a narrow or vaulted palate. So again, utility wax lined on the palate of the tray, like in the picture, is very helpful. And again, just rubbing the alginate where you need to get that you're missing. For proper disinfection of their impression, they need to rinse the impression immediately upon removing it from their patient's mouth. Then they should spray it with Cavicide and let that sit for 10 minutes. At that time that it's sprayed with Cavicide is when a faculty member can look at it and evaluate it. And then once they're waiting for their Cavicide to set for that full 10 minutes, the student should wrap their impression in a wet paper towel to avoid any syneresis that would cause a change in the alginate. For proper pour technique, we want a putty-like consistency for our pours. And then it's really important to start on the back of one side of the arch with the tray being held at an angle so that the material will flow in a horseshoe shape from the posterior of one side to the anterior to the posterior of the other side. For the art portion, we do have base molds, and I want to encourage everyone to have the students use the base molds. So they are in the drawers on the back wall where the model trimmers are, and pretty much they can just pour gypsum into those base molds and it makes the art portion for them. So please use those. If the student is not waiting a long enough time before seating the tray on the base, it will likely sink in. But if you have your base material thick enough, this is really not an issue. One thing I do see pretty commonly with students is that they let their tray get locked into the stone material. So the bottom picture on the slide really shows you how that tray is not covered by any stone material that would make it get stuck to the model when you're trying to remove the tray. And then we want the students to wait probably about 30 minutes before they try to separate their tray from their model. We want the stone to be cool and dry to the touch. If it's wet or warm at all, it is not ready to be pulled. For their cast, once they do successfully pull their model, we want to make sure that we don't have any voids in the cast. So if we have voids in our impression, they are going to show up on the cast. And if you pour too quickly when you are trying to pour up your impression, that's another way you can get voids that are not present in the impression but are present in the cast. Again, I talk about wiping material on the occlusal surface and proper mixing to avoid voids in the impression. And then for the pouring, again, we're just talking about making sure your material is the correct consistency. So if it's too thick, it won't flow through the impression very well. If you try to speed things up and go too fast, that's going to trap air and cause voids. And then if you're not following that horseshoe technique, like that U shape, then that definitely will trap air and cause voids. Generally, we want the occlusal plane to be roughly parallel to the countertop. So when they are placing their tray onto the base portion, just making sure they're eyeballing it. We're not asking for perfection, just generally a quick eyeball does it look normal and even. And then lastly, we want to make sure that they're not breaking any part of the cast during separation. So we do have lab knives that are on the magnetic strip along that back wall that they can use to kind of help separate their tray from their material. We want to make sure they're not putting uneven pressure or pulling really hard in one direction or another. So we want to make sure that they are pulling straight up as much as they can and not rocking from side to side, because that is how they frequently break teeth. Again, this video was just to help kind of address concerns that students had that it is difficult to get feedback for impression and pours in clinic because not everyone is pouring impressions very frequently. So I hope this helps you feel a little bit more confident with what is expected of the students on their competency and how you can help them as their educator in that setting and help them get the best impression and pour that they can. So again, if you have any questions about it, I'm happy to help you. My email is listed on the slide. Thank you.